Welcome to the Health Teacher Series on Probiotics. Hi, my name is Dr. Morello. I am a licensed naturopathic physician here in Vancouver, British Columbia, practicing at BC Women's Hospital. And my focus is really utilizing integrative medicine to treat complex chronic diseases such as fibromyalgia, chronic fatigue syndrome, myalgic encephalomyelitis, and Lyme disease. And I really feel strongly that most of these and other like conditions really have their origins in the gastrointestinal tract. So today's topic on centering around probiotics, it really is an important one. So let's not waste any more time and begin the presentation. I want to do an introduction and really give focus on how environmental exposure really all starts at the gastrointestinal tract. I want to also talk about the microbiome, a glimpse into its importance. We're going to focus on the gastrointestinal tract as the fulcrum of health. How is the gut so important in maintaining systemic health? Then we're going to get into probiotics and what they do. What is the evidence that probiotics are important? And then get into this topic about human strain versus animal strains and why human strains seem to be a lot more effective. And then I'm going to talk about a probiotic that I've used for over 15 years, Bifidobacterium longa BB536, and why this probiotic really stands out amongst most probiotics in the marketplace. So the beginning of my presentation really centers around this slide that I use in most of my presentations. And what you see here is two individuals. One is on the right side is over 6 feet in large frame, while the other is about 5'10" and medium frame. And these are scientific photos. And what's interesting about these individuals, they also have different diseases. But the most interesting part of this picture is the fact that these two are identical twins. Yes, their DNA is exactly the same, yet they look completely different. So obviously the question is, what happened to these individuals? We thought genetics dictates everything, but what we're learning that it doesn't. These two individuals were separated at birth. They grew up in two different environments. The foods they consumed, the water they drank, the nurturing they received, that changed the way their DNA was expressed. In other words, the phenotype changed. And so you see two different individuals all of a sudden. So DNA is really not a destiny. So the destiny is the environment, which really takes us to what is the environment. The environment is everything around us. It's the air that touches our hands, the liquids that come in contact with our skin, with our face, the things we breathe in. But more importantly, the biggest contact of the external environment with our bodies is really the food that we consume. If you think about it, that is the most densest, the largest amount of things that come in contact with our bodies is the food we consume. And where does that food go? It goes into the gastrointestinal tract. So really the integrity, the interaction of that food with our gut, what actually ends up coming into our bodies, and the integrity of the health of the gut really predicates our general systemic health. And so this is where it all begins. And so let's look at what's going on in the gut from a bacterial perspective, and let's look at the definition of a microbiome. The microbiome is defined as the collection of microbes or microorganisms that inhabit an environment, creating a sort of mini ecosystem. So our human microbiome is made up of communities of symbiotic, commensal, and pathogenic bacteria. This can include fungi, can include viruses, all of which live in our bodies, live in our gut, and this is what they call their home. So the balance of these microorganisms really plays a much larger role than we ever thought in systemic health. So in other words, by improving the microbiome, by improving the community of these bacteria in our gut, we can improve or have real beneficial effects on overall health. Here's some really interesting thoughts that really kind of start really giving us impressions. Wow, this microbiome, these bacteria of the gut really have a big play, or may have a big play in systemic health. So let's look at some of the animal studies. What they did was, in this first one, they actually they took genetically obese rats. They took the bacteria of these genetically obese rats found in their gastrointestinal tracts, and they inoculated rats of normal size. What happened to those rats is they all became obese. just by the transplantation of bacteria, not changing the diet whatsoever. Then he did the same thing with genetically lean rats. He took the microbiomes of the bacteria of these genetically lean rats from their gastrointestinal tract, and they inoculated rats of normal size. Diet didn't change. Guess what? All those rats became thin. Interesting. Yes, very interesting. Part 2, eradicating C. difficile using microbiomes of human donors. Now, this is a fascinating one that's really taken a life of its own. And this is basically, I'll give you an example. C. difficile is one of the most dreaded bacterial infections of the gastrointestinal tract. Patients can have diarrhea for weeks, days, months. I'll give you an example. 30-year-old female goes into a hospital, develops C. difficile, and she's placed on IV antibiotics for 1 month, 2 months, 3 months. The antibiotics are not resolving the issue. She's lost over 40 pounds. She's in critical condition. What they've done, what the gastroenterologist did, went into her husband's gastrointestinal tract, removed bacteria, inoculated her with those bacteria, and guess what? The C. difficile disappeared in 2 days. In other words, the bacteria of a healthy donor were more powerful than the most powerful antibiotics in the world. Isn't that incredible? That's amazing. That experiment's been repeated hundreds, thousands of times with 100% success. In other words, fecal transplantation is 100% effective against C. difficile, one of the most dreaded bugs that antibiotics really have a hard time controlling. Interesting. Very, very interesting. Part 3, prescription antibiotics can change the microbiome. Yes. So when we take antibiotics, and remember, antibiotics have a lot of very important uses, but when we take antibiotics, they actually impact the microbiome. They kill off bacteria. And one study actually found that those bacteria, the normal bacteria living in our gut, never actually came back to their full numbers, which is really, really interesting. So it takes a while, or sometimes it can't reverse when you knock off some of these good bugs in the gut. Last but not least, the family of bacteria in the gut really can have an impact on gut permeability. And this is going to become an important topic of discussion as we move forward with our presentation. So it all starts in the gut. Oh yes, it does. So you know what most of us know is that the gut is a place where we break down food particles into small, tiny little micronutrients, and then we absorb those nutrients and we eliminate waste. So the gut is a place of breakdown and absorption of nutrients and elimination of waste. And I think most of us know that, but one of the things that now actually a lot of people are starting to know is that 70 to 80% of our entire immune system is located in the gut. Yes, in the gut. A lot of people ask me, why is it there? Well, there's a number of different reasons. One, the most abundant antibody in your body is something called IgG, and 100% of IgG is actually made in the gut. But more importantly, if you think about it, you know, your immune system is supposed to defend you from foreign invaders. Well, where is the largest risk of foreign invaders coming into our systems? It's where we have the most exposure. And where's that? It's the gut. So if you were to put guards in your house to guard against burglars, where would you put them? In the front door and the back door, the main entry points. So our immune system is located in the gut because that's the main entry point to our bodies. An interesting point, there is as many neurotransmitters produced in the gut as there is in our brain. We've all heard of the gut as the second brain, but did you know there's as much serotonin produced in your gut as there is in the brain? So the thing is here, so if we have an unhealthy gut, does that impact neurotransmitter production as well in the way that we feel? Absolutely. There's no doubt of that. Another interesting point, there's over 100 trillion bacteria in our gut, and these bacteria do all sorts of things that are very, very important. So keeping that family of bacteria healthy becomes another critically important component of health. And then my last one is the one-cell paradox. This is one of my favorites observations, and that what separates everything in your gut, all that stuff inside your gut, all those 100 trillion bacteria, good and bad, all that material in the gut from the blood is actually one cell. One microscopic entity, something that we can't even see with the naked eye, is all that stands between everything in our gut entering our bloodstream. That's a paradox, because that one cell lining has to be strong enough to block those things from getting inside the blood. At the same time, has to be permeable enough to allow nutrients to get inside the blood. So it really is a paradox. And this is where a lot of the problems begin, because that one cell lining can break down. So here's a wonderful drawing, and to the right side you will see the one cell barrier. Here's your blood vessel. Here's the cells. One cell separates all that from inside. So you know that the integrity of that cell barrier has to be really, really firm. And what happens is that one cell barrier can break down. And when it breaks down, things can translocate. In other words, things that shouldn't be getting inside the blood do get inside the blood, and they create a lot of problems. One of the explanation I often give my patients to further elucidate this is my famous roof analogy. So think about the lining of the gut like a roof on a house, and inside your house is your body. So, for example, the sofa, the leather sofa is like your skin, and the TV set is like your brain, and the hinges on the doors are like your joints. And think about if the roof had holes in it and water came in, and the water fell on the sofa, it would create mold. That's like almost developing like eczema or psoriasis. Say that the water fell on the TV set. That's like having brain fog. Say that the water fell on the hinges on the doors and they rusted. That's like getting arthritis. And what really happens is, this is the kind of the idea that happens. You can get a translocation of compounds from inside the gut into the blood. There's antibodies that are made towards that substance that just got incorporated, and that antibody can actually go and attack joints and create arthritis. So this is the kind of stuff that keeps going on all the time. We're seeing bacterial particles that actually translocate, getting inside the blood and impacting cellular function. And one of the telltale signs of this is really stress. And most of the patients that I deal with, when they are stressed, their symptomology really goes way up. I mean, they have a lot more symptoms. And I'm sure that you are very familiar with that we blame stress for lots of things, right? I got sick, I got a cold because I was under tremendous amounts of stress. So what is stress doing that's creating all these things? That's the question. And the answer to that question is something called the sympathetic response. And to explain that, I'm going to give you the zebra line analogy. If you give me a moment. So when the zebra meets the lion in the jungle, the zebra is going to be extremely stressed. Why? Because the lion is going to eat it. And so the zebra really has two choices: either fights the lion or runs away. That's why we call it the fight or flight response. And at that particular moment, what happens is something really, really important. The sympathetic response kicks in. It sends signals from the brain to the gastrointestinal tract to shut blood flow to the gut. In other words, 1/3 of your entire blood supply is in the gut. By closing those blood vessels, it pushes blood to the peripheral tissues, to the zebra's limbs. Why? So the zebra can run faster. When that occurs, there is a lack of blood flow to the gut. There's a lack of oxygenation to the gut. So what happens? The integrity of the gut goes down. The immune system goes down. Neurotransmitter production goes down, and gut permeability increases, and this creates a translocation. In the zebra's case, it's for 10-15 minutes. And the zebra is going to beat the lion, and everything comes back. So it was worth the stress, wasn't it? But think about in a human case. Humans are stressed for a day, a week, a month, a lifetime. What damage does that cause? And this is really at the cusp of, at the fulcrum of a lot of conditions. And so increased gut permeability is now linked to numerous system conditions like type 1 diabetes, inflammatory bowel disorders, Crohn's disease, IBS, celiac disease, arthritis, complex chronic diseases, and many, many more. So you see, the health of the gut really becomes an important component in systemic health. So let's continue our discussion and look at the gastrointestinal tract. And I'm just going to give you just a brief kind of flyby through the gut from the mouth all the way down. And one of the first things I want you to look at this picture is really the fact that as you get lower and lower into the large intestine, starting from the esophagus all the way down, you find that the number of bacteria, or the microbiome, becomes larger and larger. There's much more concentration of bacteria in the colon as opposed to the stomach, which is really interesting. So that's something to note. So food actually enters the mouth, goes down the esophagus, goes into the stomach, and in the stomach, one of the things I'll discuss with you is that acid is secreted in the stomach. lots of hydrochloric acid. And the acid really plays a number of different roles. There's always been, so what's the pH of the stomach? Well, it's a very, very low. It could be a pH of 2 to 3, sometimes 1.5. And the pH of the stomach is that low for a number of reasons. One, it helps break down proteins. And second, it kills all the bacteria, all the microorganisms that are in the foods we consume. So it's kind of an annihilator, preparing or eliminating microorganisms that could interfere with the microbiome down in the small intestine and the large intestine. So this is one of the reasons why stomach acid is pretty important. And when we take away that stomach acid, we could create a lot of problems that a lot of people are familiar with. So then what happens is once the food leaves the stomach, goes into the duodenum, which is the first part of the small intestine, and here you have enzymes that are secreted in, like amylases, proteases, lipases. Lipases break down fats. Bile is secreted into the duodenum as well from the gallbladder and the liver. The liver is making the bile, and so the bile allows fat-soluble components to be emulsified. So, for example, if I had an oil stain on my lab coat here, how would I get that oil stain off? I wouldn't use water. I would use soap with water. Soap allows oil to mix with water. Same, that's what bile does as well. So this is where bile is secreted, and then all that mixes in nicely. The food keeps getting broken down. That goes into the small intestine, through the jejunum and the ileum. In the jejunum, you have water-soluble components absorbed. In the ileum, you have fat-soluble components absorbed into the bloodstream. And then when it enters the colon's real job, interesting, the colon's job is to absorb water. So you have these bacteria that eat these little fibers, creating these short-chain fatty acids, like butyric acid is one of them. And what that does, it creates an osmotic gradient that allows water to leave the colon and enter the bloodstream. This is how we get hydrated. So, because when food leaves the small intestine, it's very liquidy. It goes through this little valve called the ileocecal valve and then enters the colon. And so it's all liquid mush. And what happens is the colon's job is to absorb 2 to 3 liters of water a day, pull it into our bloodstream. So the inability of the colon to absorb water creates what? Diarrhea. That's what diarrhea is. Diarrhea is the inability of the colon to pull water and put it into our bodies. And what is that created by? Bacteria. Right? Remember I told you that bacteria, these little bacteria, they eat these little fibers and they create these short-chain fatty acids, create the osmotic gradient that allows water to leave the colon and enter the blood. So this is why when you get C. difficile, Montezuma's revenge, remember everybody is familiar with that, with E. coli infection, you get diarrhea because that osmotic gradient is no longer produced. So, what are probiotics? Because now we're getting into the topic of probiotics, right? Because one of the things that is good for diarrhea is what? Probiotics. Constipation, what? Probiotics. So what are probiotics? Probiotics are live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. This is the real definition of a probiotic. Important to remember that human strains are significantly more effective, and we can correlate this to some of the recent discoveries or some of the recent outcomes with fecal transplantation. Remember, all those are a human strain probiotic. So always look for human strain probiotics when utilizing probiotics. And we're going to be looking further into this evidence that really supports this premise that human probiotics are much more beneficial than animal probiotics or other types of probiotics that are in the marketplace. When you look at the intestinal microbiome or microbiota, there's another name for it, in probiotics, you see all sorts of different bacteria that we find in the gastrointestinal tract. There's bacteroids, there is enterococci, there's lactobacillus, there's Clostridium, et cetera, et cetera, et cetera. There is a lot of different families. Altogether, there's over 100 trillion bacteria weighing in excess of 2 pounds. To kind of simplify it a little bit, there's really there's more than 2 families, but there's 2 major families. One is Bifidobacterium, and so these are all the Bifidobacterium species that you find, Longum, Infantis, Breve, Bifidum, and all these are found in the large intestine. So one of the things about Bifidobacterium, it is found in the large intestine, as opposed to Lactobacilli, which is found in the small intestine. This is Lactobacillus casei, Lactobacillus acidophilus, etc. There's also other types of families, not as large as these 2 that I just mentioned. Saccharomyces is one of them, Enterococcus is another. So, these are the species of probiotics that you will find in the marketplace. What's one of the interesting things, and this is a really interesting slide, the effects of intestinal bacteria on the host, the good and the not so good. So when you look on the left-hand side, Bifidobacter and Lactobacilli, you find that both of these probiotics species really stimulate vitamin synthesis. They actually definitely improve the intestinal environment. They can help you prevent infections. They have immune stimulating properties as well, as opposed to some of the other bacteria that aren't so good. And those things can cause intestinal putrefaction. They can cause microbial toxins. They can the production of carcinogens, pathogenicity, and these are all the not so good bacteria. So we have the good, the useful actions, and the harmful actions. So what does that tell us? It tells us that, if we can bring about more of the good bacteria, we can have less of the harmful actions of the gastrointestinal tract. So this is pretty important to keep in mind. One of the things that we are also noticing is the change of the microbiota or the microbiome with age. And one of the things that you see here is Bifidobacterium really dropping as we get into adulthood. We have high levels in the early years, but as we get older, there's less and less of them. So one of the things we want to do is, what happens when we have less of these bacteria? So what's interesting here is this next slide, where why Bifidobacterium? Why is it important? Well, as an infant, 99% of our bacteria is Bifidobacter. Well, in the adult, when we become adults, there's less than 11%. One of the interesting observations here is that what you see is when we have 99%, as an infant, there is less intestinal putrefaction products, ammonia, indoles, and phenols, and they seem to be related with the levels of Bifidobacter. And I think this has been already studied and proven. As you become an adult and you have less Bifidobacter, there is more and more of these intestinal putrefaction products. So the idea here is, if we increase the level of Bifidobacter, do we have less intestinal putrefaction product? And the answer to that question is yes. So very, very important to keep that Bifidobacter up. And so a lot of people ask me, well, why is it going down? Well, it's probably going down because we're introducing new types of bacteria from the foods we consume, from the lack of acid in the stomach, from bad diets. There's all sorts of reasons why the family or the microbiome changes as we get older. Again, why Bifidobacter? Well, here's another reason. So what are the bacteria that you are all familiar with? E. coli. E. coli can be can have really negative effects on health. You can get diarrhea, you can get all sorts of other things that it can cause. And one of the ways of eradicating E. coli is really with acetic acid. So I want you to have a look at this graph where E. coli was exposed to hydrochloric acid, lactic acid, and acetic acid. And the acetic acid really had an inhibitory effect on the growth of E. coli. In other words, acetic acid eradicated E. coli compared to other types of acids. Why am I telling you? What's so important about acetic acid? What does it have to do with Bifidobacter? Well, Bifidobacter has a real effect on increasing or producing the levels of acetic acid in the gastrointestinal tract. So it elevates the levels of acetic acid, therefore inhibiting one of these bad bacteria, these E. coli bacteria. So here's another reason why Bifidobacter is important. And again, here's another one. This is the effect of BB536. Remember? Bifidobacter longum BB536, that's the strain on infections. And so what's happened here, again, the infection is E. coli 0157. That's just a type of E. coli. And what they've done here is they've given both groups of rats the infection, the 0157 E. coli, but the red mice, they took the BB536, the Bifidobacter longum probiotic. What do you see? Well, you see that after 5 weeks, the green, the rats that did not take the BB536 all died, while the rats that took the BB536, the mice that took the BB536, all survived. So again, this tells us that the BB536 is having a really effect on the E. coli. It's knocking the E. coli out, therefore allowing the survival of these mice. Very, very powerful slide. Another interesting thing that Bifidobacter longum human strain versus animal strain, so this is human resident bacteria, non-human resident bacteria, is the production of folic acid. Now, folic acid is important, as you all know, in so many different aspects, and the human microbiome actually can produce folic acid, specifically Bifidobacter longum, BB536, as you can see down here. It produces a lot of folic acid. Now, the thing to pull out of this diagram is the fact that the animal-based probiotics do not produce a lot of folic acid, while the human strain produce large amounts of folic acid. This is important to know. Here's a comparative. This is in vitro. In vitro means in glass. A study where they compared the BB536 to other types of Bifidobacter, and that the BB536 really has a higher production of folic acid in vivo as compared to other human strains. And you see the animal strains to the right here, very, very little folic acid production. Oops, we just bumped a few slides here, but here we go. We're back. Again, using Bifidobacterium, you can see the blood parameters all improve with the BB536 in red over other Bifidobacter bacteria, both human strain and animal strain. So you see that there really is a benefit to utilizing the BB536 in the body. In summary, Bifidobacter are different bacteria from ordinary lactobacilli. Human and animals have different Bifidobacteria species, so we really want to use human resident bacteria, human strain species, because they're much more effective. And the studies have demonstrated that there really are differences in these two types of bacteria, human strain versus non-human strain. So without question, and this is something that I recommend to all my patients, that human resident bacteria, human strains are much more suitable to be utilized by humans and infants. So when you look at picking a probiotic, there's the genus is the first name, the species is the second name. So Bifidobacter, that's the genus. The species is the longum, and then the strain is the BB536. So it's always important to. It can be very confusing. I totally understand. So remember the BB536. It's one that's really worth remembering. And my first experience with BB536. So I guess this is a good time for me to share that with you. Was about 15 years ago, and I had some patients come in. They were referred to me by another physician, and these patients they were philanthropists, and they would go to Africa, and they would get sick every time they would go there. They would get diarrhea. And so they always would utilize antibiotics to counteract the effects of the diarrhea. And but they had read something that antibiotics had all sorts of side effects, and they didn't want to do that anymore. So they came to me to see if I had an alternative. And the only probiotic that was room temperature stable back then was the BB536. So that's what I gave them. And because they're going to be flying, and they're going to be in there's no refrigeration, and et cetera, so you can't refrigerate it. So I gave them BB536. I remember it was like I told them to take 5 to 10 billion a day, and they came back 3 months later and they said got no diarrhea, and then before you know it, I had truckloads of philanthropists coming to me, figuring out how they cannot get sick. Utilizing my great technique. It was the technique was pretty simple. It was just I said just go to the store and buy it. It wasn't too complicated. So that was my first real experience of the BB536, and I've been a big fan ever since. I've used them for over 15 years now. So Bifidobacter longum BB536. Here's a picture of what the bacteria looks like. So physiological effects of BB536, there's a number of them. One, it alleviates the occasional diarrhea. It can alleviate constipation. It can improve intestinal environments. Really, really important to change the environment of the intestine. In other words, what they can do is actually, because of the effects that they have, like, one, I showed you the acetic acid, increasing acetic acid, it'll knock off some of the bad bugs, which allow the good bugs to kind of grow. So this is how these things actually work. We're learning more and more about them all the time. We're learning that they could be creating antibodies and knock off bad bacteria, creating and keeping the good bacteria, improving the overall microbiome. We've seen that it can enhance bone strength, so it has some applications where the delivery of calcium and the trabecular structure of bone. So this is new information that people never thought of. My goodness, probiotics and bone health. Well, probiotics and weight loss. I mean, they have so many different applications. It stimulates immunity, so it definitely has an effect on the immune system, and also can improve the integrity of the epithelium. So this is one of the things that I personally push. I mean, the studies show that it may improve, but I really feel like this is an important component of that integrity. Remember, keeping that the one cell paradox, keeping those cells tightly knit together so things don't translocate. So this is another thing that these probiotics may be very, very useful for. Here's the effect of BB536 on the intestinal environment. So to make heads or tails out of this, okay. So let's have a look at this. So you have a couple of parameters that we're measuring here. One is defecation frequency, how many times does a person go to the bathroom, and ammonium in the feces. So what you see is the interval phase, the placebo, yogurt, and then you see the BB536. And when you look at this one, so this is the 23.1%, 23.7, 34.4. That's the percentage of bifidobacterium in the fecal microbiota. And what you see is that the one that was given the BB536, the bottom one, you see more defecation frequency. This is what you want. You don't want to be constipated. You want to have bowel movements, and you also see less ammonia. This is ammonia is one of the it's a toxin that's produced in the gut. So you have less ammonia produced of those people that took the BB536. Again, more evidence that the BB536 really has an impact on the intestinal environment. Here is the effect on BB536, Bifidobacter longum, on infection and immune modulation. This is a double-blind, placebo-controlled parallel study. So what they did here is these are elderly patients, 65 years, residing in a nursing home, as you can read. The BB536 group, there was 13 patients there, and then the placebo group was 14. And so, placebo, there was nothing, it was just a powder, but there was really no active component. In other words, the active component here was the BB536. 10 billion was the CFU count that they were given. So what happened here is the study schedule for a 6-week period. This is stage 1. Both groups of patients, both the placebo and the treatment group, both had the BB536. And then after 6 weeks, for 14 weeks, the BB536 continued taking BB536, and the placebo group just took a placebo. That was 14 of them. And so what was the end result? Well, the end result was that the subjects that did not take the BB536, 5 of them developed the flu. So almost half of that group developed, or over 30% developed the influenza, while the BB536, that group, none developed the flu. When you look at natural killer cell activity, you find that the patients of the BB536 had an increase in natural cell activity, as opposed to the placebo group that had a downturn in the activity of natural killer cells. Natural killer cells are a type of white blood cell that can go in, they can knock things off right off the bat. They can kill viruses. They actually kill cancer as well, but they can go and knock off all sorts of invading microorganisms, and they can knock them off. So this is maybe one of the ways that the BB536 actually worked in this particular case. So this is another study really supporting the credence that the BB536 has a real effect on immune health. When we look at the stability, and this is one a parameter that I often look at, what is the stability of the probiotic? You can see that the BB536 is extremely stable as opposed to other products. A lot of products need to be refrigerated, or they start there's a die-off. Well, the BB536 is quite stable at 77 degrees Fahrenheit or 25 degrees Celsius. Look at the stability, stable over 36 months. This is wonderful to know and wonderful to utilize. That we have whatever it says on the package. Well, you're going to get that for 36 months, and that's important to know. So stability is something that I've always looked for in a probiotic. Now, what are these CFUs? These colony forming units. This is the way that probiotics are counted. So you have billion, you have 10 billion, you have 100 billion. So this is the standard of measure. It's one of the most confusing things because I know patients come to me, what should I take? Should I take 50 billion, 100 billion? Which one is it? And it's an interesting time we live in, where we sometimes think that more is better, but not necessarily the case. And different people can tolerate different amounts. The BB536, I often get 5 to 10 billion and work very, very effectively. I brought in a little bit of a study here because I want to show you this, because this is interesting. So again, we have bifidobacterium, changes in gastrointestinal symptom severity after 4 days of supplementation with bifidobacter. So both of these groups took bifidobacter. So the ones in red took 1 billion, and the ones in blue took 10 billion. The reason why I want to bring this up is because this is the reduced symptomology. So the higher the graph, the less symptoms they had. Okay, so I want to make sure that everybody understands these bars. And so there was gurgling, abdominal pain, flatulence, constipation, irregular bowel movements. So these are, we consider these, kind of medium, light to medium kind of gastrointestinal symptoms. But you can see that the 1 billion count bifidobacter had better effects than the 10 billion. So it's not always about count. So that's something important to really, really keep in mind. And so, people react differently to these bacteria. So I think keeping these counts, the 1 to 5 billion, sometimes 10 billion, I think it's the number. I'm not completely sold on these high counts that we're now seeing in the marketplace. So when choosing a probiotic supplement, what do we want to look for? We want to look for human strains. We want to make sure that it passes through the intestine. We want to make sure that it attaches to human epithelial cells. We want to make sure that it colonizes the intestine, that it produces acetic acid that's known to inhibit pathogens and bad bacteria, and they're safe for clinical use. And one of the great things about BB536 was over 100 studies with BB536, really showing that it's a very, very safe probiotic to take, that has long-term benefits, that it adheres to the gastrointestinal tract. It is a human strain, so it really has all the qualifications that you want to look for a probiotic. And one thing that's really, really important to me, anyways, is that they're room temperature stable. They don't need to be refrigerated. So, and so everybody asks me, so wait, why is that so important to you? Well, because it's important to me because when you have a refrigerated probiotic, you pull it out, there's things that are dying in it. That's why it has to be refrigerated. So, how long did it take to get from the manufacturer to the store? How long did that take, or to the doctor's office, or wherever, who was ever dispensing it? What was the transfer from the store to the house, and what was the heat of the car? There's so many parameters. How many times it got taken out of the fridge and opened and kept on the counter? So all these things, really, you lose what the count actually is. So with room temperature stable probiotics, you eliminate that, and BB536 certainly does that. So anyways, that is the end of our presentation. So you can see, BB536 is a phenomenal probiotic to use. I've used for over 15 years, and it's something that I would highly recommend people take. You will see an effect with this specific type of probiotic. There's a lot of probiotics that I know are hit and miss, and I hear this all the time with my patients. So I wanted to share with you, my whole practice is based on outcomes and having patients get outcomes, and this is a probiotic that I'm very confident will give you the outcome that you all deserve to have. So thank you for listening. I hope you enjoyed the presentation, and I hope to see you soon in another Health Teacher Series presentations.